So we're going to go into some clinical images now and show you a little bit about what to look for and how to interpret the images. So as you can see here, we have a bite wing radiograph, a clinical photograph, and a DIAGNOcam image. As you can see clinically, there is an amalgam restoration with a small buccal cavity. On the bite wing radiograph, you can't really see any shadows, but when we look at the DIAGNOcam image, we can clearly identify the size of the recurrent decay by the dark shadow around the restoration. This tooth has a small fracture on the cusp. You can then see quite a dark shadow underneath it. Clinically, you can't see too much from the image. Again, the X-ray didn't give us a clear indication that there was decay there. The decay was quite extensive and the tooth as a result was direct pulp capped. These are some brief clinical examples of what other types of decay can look like. For pit and fissure decay, you can see dark aspects, and it's only the decay part that was actually shown dark. So just to reiterate, if you do have stained fissures, it will transluminate through that because it's not actually decay. Interproximal decay. You can see that there is a clear breach of the enamel dentine junction on both of these. When there is interproximal decay under restoration, such as composite, it's going to show you the extent of that in a dark shadow which will leak underneath. For interproximal decay, if it hasn't breached the dentine yet, you can easily monitor with the DIAGNOcam and review when the patient comes in for their next visit. Typically, this is what to expect for tooth fractures. The fractures have opened up, bacteria has gotten in, and the decay process has started, which shows us black fractures. When looking at composite restorations, it's easy to see the leaking restorations and how dark they have become due to the underlying decay.